Hello, Cordova. We'll be interrupting regular programming to bring you a conversation between myself and Mayor Koplin about the latest COVID-19 information for Cordova. Welcome to a special program here with Mayor Koplin because what was it? Was it FDR that did the fireside chats? Now I'll probably expose my lack of a knowledge of history, but
I think it was FDR actually.
So we had a conversation yesterday on April the 1st and came up with the idea that it'd be good for you to be able to relay the knowledge of the incident management team kind of on a more regular basis to get more information flowing and let people know what's going on behind the scenes, that they don't have any way to see all of this work that's being done, the conversations that are being had, and so forth. So it's difficult for the public to know that it's going on. And so what we hope to accomplish here with a series, we're hoping of daily visits through the week, is to get some of that out there, to let people know what's being done, what's being thought about, and to have you, as in your position as mayor, to speak to some of those things. So, Clay, I know you're amazingly busy right now wearing many hats, so let me first of all just thank you for being willing to join us and share what it is that we can get out there for right now.
You bet. Thank you, JR, and I appreciate the talk yesterday and from our city council meeting last night too. It's been pretty quiet in terms of public information. Ironically, we've prepared a lot of information for the public, but between the fast-moving virus itself and then the kind of onslaught of federal mandates, state mandates, and then our own city mandates that we've seen put in place over the last couple of weeks, it's taken us time to assimilate them, and it seems like no sooner do we get a press release drafted than a new state mandate completely changes what we were going to say. So I know it's been very frustrating for the community, and we recognize it's been a bit of a vacuum. So today, I thought we would just start off with kind of a real high overview, and then we can really get into specifics as we move forward. In fact, there are going to be a lot of details left out of this first one today that just encourage patience and encourage people to tune in every day. And then we'll have some other mediums, the questions and answers that have been submitted through CordovaPrepared.com. We just answered those, and we should have those posted in the next couple of days. We've been listening to the community and their questions and shaped specific answers, and we will address some of those. So I'll start out with just at the federal level. What's going on right now is we do have a stay-at-home advisory for all American citizens. Now, all the states haven't implemented those, but the federal government is advising everyone to stay home. And that means engage in only your essential activities, leaving home to get food, medical care, or provide essential services to others who are staying at home. That is the single best way to get this virus under control. And in the terms of Dr. Fauci, this isn't something that's going to be fixed by a policy. It's something that's going to be fixed by behavior. So the single best location for federal information, including a lot of great tools for home sanitation, distancing, and keeping yourself and loved ones safe, is at www.cdc.gov. So another important aspect at the federal level is the new CARES Act that our own congressional delegation has very carefully crafted to make sure that Alaska and our unique circumstances benefit. And you may have seen the briefing they had the other day on the evening news. But that package provides significant financial relief and resources to citizens, businesses, schools, hospitals, municipalities, nonprofits, and others. And those programs are being pushed out over the next few days on various federal agency websites and portals for business. That's SBA.gov or the Small Business Administration. And we'll be posting more information on links to those. But it's important for Cordova citizens and organizations to review and understand and take advantage of those programs and resources as we manage what is going to be the second phase of this disaster, which is economic devastation. And so we want to take advantage of those programs.
Okay.
At the state level, okay, go ahead.
No, I'm sorry. I was just going to say, what about at the state level?
Yeah, you bet. So the hierarchy is that the federal government and the president, during a state of emergency, which we're in right now, sets the standards at the federal level, and then they decide how much flexibility they're going to give to the state. And so, for example, the federal government has advised everybody to stay home, but they haven't mandated it. So in the state of Alaska has advised everybody to stay home. And there are also other state mandates in place. And then at the local level, we follow whatever guidelines and use whatever flexibility the state and federal government allow us to. So the hierarchy is the state sets the rules, and then, the federal government, then the state, then the city. And it's pretty much the same if we go to the next step, which is martial law, and then we're basically under a state of military governance. So the state has put a lot of mandates in place. The more important ones are the stay-at-home advisory, which is a 14-day quarantine requirement for all travelers to the state of Alaska and within the state of Alaska. State has also closed non-essential businesses for walk-in service. And that includes high-touch things like massage and acupuncture, for example, and hairdressing and tattooing and things that really maybe don't have to be done right this minute.
Sure.
And another important requirement by the state is, or another important clarification is that state troopers and local law enforcement are empowered to enforce those requirements. And there are some pretty stiff penalties for violation of some of them, up to $25,000 in Class B felony. So that information and more specific to the virus itself are available at coronavirus.alaska.gov. So that's kind of the state portal for mandates and information. And they have a lot of links to the CDC and the federal programs.
Yeah, it's a very comprehensive site. We've been looking at it a lot in our analysis of the mandates and how they intertwine. So that brings us home now. Where is the city at in terms of fitting into this?
Okay, so I think it's important for the community to understand that the City of Cordova and our emergency management organization is very well established in our codes. We've had extensive training over many years, and frankly, the City of Cordova's emergency management organization is considered one of the best in the state and is a model and actually has done training for other communities. And we actually have a pandemic sickness as one of the specific scenarios that we have a plan in place for and that we've trained around. So while the community may not be seeing a lot, I can say with high confidence that your city staff and emergency management staff are not responding to this with a knee-jerk. In fact, we started working this. Our emergency management coordinator started working this daily on January 23rd, and we've been adapting our response to the course of the disease as we learn daily the path of the disease and the responses and protections we can put in place. That started mostly with our medical profession in February and March, where all the medical professionals in the community, CCMC, ALANCA, and public health nurse developed and implemented a coordinated care and response plan. So they've all been working together, meeting daily, setting up special areas within the hospital and other facilities, sharing or parceling out different parts of the response. This has been in place for weeks now, and it's part of the reason that, and I'll get to this a little bit later, that we so far have seen a low incidence of concern with or low incidence of actual virus here in the community. Mm-hmm. So there's also intensive planning in place for contingencies. So the healthcare system is fortunate that we, here in Cordova, we already have a very established remote response facility framework here. So there have been a lot of questions about, well, what happens if somebody gets sick and has to be medevaced out? That's business as usual for us. So the fortunate thing is all the responses that we need for a pandemic like this are already in place. and we have those well established, and we have options and alternatives, and it's something that we practice. Medevacing out of Cordova is not something new, trust me. And so that's actually a good thing. So specifically on March 16th, the city of Cordova declared with my declaration, we declared a state of emergency, and the city manager then becomes the CEO or the executive, as it were, in this response. And she's been managing the legal and administrative role, and I should say co-managing. None of this happens in a vacuum. We work as a team.
Right.
And we've been implementing the local mandates that include the self-isolation requirements for travelers, the informational bulletins and advisories that we've been posting on the website, and now that we're starting to open up through venues like this very one that we're discussing now.
Okay. So some other points that, in terms of, and let's point out now, we're scheduled to have, are we not still scheduled to have a visit on Friday where we're going to actually, I'll be interacting with you and other members of the team to do a more extensive question and answer session that we'll play on the radio after the 4 p.m. briefing tomorrow. Is that still the plan?
Yes, that's exactly the plan, and to do that weekly. So this is a very big, small bite, as it were, because it's our first one. But these are going to boil down to just a few minutes of really critical and pertinent information that we can get out every day.
Right. And you and I won't be talking for as long as we are now for these daily ones, but we do hope to have them be daily, and then we hope for a more extended visit with the larger team on a weekly basis to answer the very high volume of questions that have been coming into your Cordova Prepared at yahoo.com address. Well, so let's some of the things that have been that have been part of the chatter, I guess, are if we want to stay at 0 confirmed cases, which is, as we speak, the status that Cordova is in now. Why not just close the airport, stop having people fly in? So why not do that?
It seems simple on the surface.
Yeah.
Well, the first thing is most of our medical providers arrive and leave by the airport. So our medical services themselves require air travel. And I guess at a more practical and functional level, the airport is a state airport. It's federally funded. And the federal and state government have said, under no uncertain terms, is that they will not allow the closure of any airports. Foods, medicines, critical services come and go through airports, and we cannot close that airport if we wanted to, unless we perhaps want to meet the National Guard.
Yeah. That's a good point. So in other words, when it comes to closing the airport, if somebody wants to lean on someone to make that happen, the city would not be the place. That person would have to contact state or federal officials to see about whether or not that's a possibility. But expecting the city to do it, it's just not possible.
No. And so what we are doing is, and you've seen these through the mandates, both at the federal and state and local level, is putting restrictions in place. The state of Alaska is requiring everyone coming into Alaska to sign a form, to fill it out, to show them, explaining where they're going to quarantine, what their ultimate destination is, where they've been, a few questions so that they can track. And this was one of the good questions and suggestions at the council meeting last night, so that they can track anyone who does get sick. And it also is some accountability and some visibility for the community. And then, of course, at our local level, we have our own requirements in place for someone stepping off the plane.
Sure. Okay, and then another thing that's been talked about fairly, well, I mean, it's hard if you live in a Facebook world, but something that's being batted around, we'll say, is in the interest of not bringing a whole bunch of people who could be potential carriers, why not close the fishing season and say, hey, we couldn't fish when there were certain other disasters. I don't remember if the quake was one of them or the fire, or, obviously the oil spill screwed things up a lot when that happened in '89. Cordova has not fished before, so why not just shut it down in order to absolutely minimize exposure to the virus?
Well, I'll try to boil this down into a very succinct answer. But this is a global epidemic. Seafood production is part of the bigger category of food production, which is really critical to the country. And again, looking through and beyond the pandemic, several 100 million pounds of high-quality protein going into the American food market is a critical resource. And again, the federal government and state governments have made it clear that that's not just Cordova's livelihood, it's also America's food, and it is important to produce that as carefully and safely as we can. So I guess to put a shoe on the other foot, what if, for example, California said, well, we're not going to let any food come in or out of our state, and so sorry, Cordova, but you don't get any more produce or manufactured products or goods. So we are very much in this together. It is an important resource, and there are extremely complex legal, functional, and operational issues around closing a fishery that is, let's just say, a little more complicated than waving a wand, and involves things like the U.S. Constitution and so forth.
Okay, so again, not something that Cordova has the power to be able to do. Is that the bottom line?
That's the bottom line. And what we can do is what we are doing, which is manage it, plan and prepare and develop contingencies and safeguards on our side, encourage everyone in the community to do the same on their sides, and then work with our stakeholders, the processors, the shippers, et cetera, to make sure that they're doing their part on their side. And that's what we've been spending a tremendous amount of time and resources and diligence executing.
So you said quite a while ago well, I don't know if it was quite a while ago, maybe because it all mushes together now, but maybe it was one or two press releases ago that because some more of the talk or the chatter has been about this. When the state came out with mandate number 12, which was cutting down city-to-city travel within Alaska, there was a provision in there for small communities that meet certain criteria, under 3,000 people, and some other things, off the road system, the not having a hub hospital as recognized by or a tribal hospital. You probably know the specifics better than me, but there have been some calls and even some petitions, actually. I ran across a couple of petitions where people are trying to get that invoked. Have you guys been looking at Attachment B for a while and considering whether Cordova qualifies or not under that?
Yes, and we do qualify, and in fact, we've used that exemption and put some more restrictive guidelines in place than the state has. However, we've also been in conversations with the state and our own legal team and recognized that the intent of that exemption was for rural utilities, small villages in northern western Alaska, for example, that don't have critical production or infrastructure in place, and also have very limited access to even local triage or medical facilities or telemedicine, to give them an opportunity to put tighter restrictions in place. I have an update. As of this morning, there is not a single airport in Alaska, except one, that has exercised that and put more tighter restrictions in place or closed their airport or restricted air travel. And ironically, the one community that has put tighter restrictions in place, the net effect is that they're restricting their own citizens from coming into the community, but it does not have the authority to restrict, for example, fishermen, critical infrastructure from coming into their community. So that may not play out well for them. So I think there's a lot of misconceptions, and again, social media and so forth. Well, others are doing this, others are doing that. Well, they're not.
Yeah. Okay. Well, we'll see how that continues to evolve. And the testing is another big deal. We're hearing about The governor has a press briefing every day about testing. We're hearing about testing at the national level. What's happening locally regarding tests for COVID-19?
Well, I think this is a real good topic to kind of wrap up on and kind of build a bigger context for why information isn't shared immediately or why it isn't shared in every venue, because it's important to have a context and to put a contextual wrapper around communication. So the city has the ability, where we have right now on hand 300 test kits to administer the tests. It's a standard test that everybody's using nationwide. It's not 100%. Mm-hmm. It's about 70% accurate. So far, we've administered 9 of those tests, and they've all come back negative. So you say, well, geez, why have you only administered 9 tests? A real common question. Why aren't we testing real rampantly? Well, the entire country has a limit to how many tests are available, and we have a protocol set by the CDC that just about everybody's following, and it requires a certain threshold of COVID-19 specific symptoms before we will, quote unquote, kind of waste the test, right? We don't want to be using the test on common cold or a non-related problem. So when they reach that threshold, we've administered them and they've come back negative. So the other reason that we haven't administered more tests is we don't have a lot of symptoms out there. We don't have a lot of related symptoms or similar symptoms that rise to that level. So the good news is we just don't have the push or the requests coming in from people who even think they might have something that looks like COVID-19. So I got that right from the medical staff this morning. So
yeah.
On a local level, it looks like social distancing and our isolation and the steps we've taken so far are working well, and we're actually seeing that on the state level as well. So that's the good news, and it emphasizes how important it is for us to follow those mandates, to manage our own behaviors and our own isolation and sanitation and distancing practices because they are effective.
All right. Well, I appreciate the time. This is, again, a little longer chat than we'll probably have on an ongoing basis, but since this is our first one, we wanted to cover kind of some philosophical ground as well as new developments. So we'll bring this to a close. Mayor Koplin, thanks again. We want to encourage people, if you and I can get time, I guess we'll do this again on tomorrow on Friday.
Yeah, we'll shoot again tomorrow for a real brief update, and I'll fold in some of the other specific things. Also, I want to remind everyone, CordovaPrepared.com, CordovaPrepared@yahoo.com. Please do continue to submit your questions and suggestions. We will have Q&A posted for the first 20 questions today or tomorrow.
Okay.
We'll have a weekly press briefing tomorrow at 4. And then we'll have your aired program at 5 o'clock with a little more in-depth Q&A with, like you said, with members of the management team. Outstanding.
All right. Well, and so daily visits between you and I, weekly visits with the full team, which all of which we will, of course, archive and make available digitally for anybody who misses them on the radio, and the press briefings that you have 4 p.m. each Friday. So it sounds like the communication wheel is rolling, and I'm really glad that we had a chance to visit, Clay. Thanks for the time.
Me too, and thank you for this service. It's just really important for us to get the information out, and glad to be started down this path. Thank you much.